to our conversation in collaboration with the HSS Women's Sports Medicine Center and the Education Institute. Today we're here to discuss knee injuries in women, why they happen, and how to treat and prevent them. My name is Theresa Chiaia, and I'm a physical therapist and a clinical lead in sports rehab and performance at HSS. I'll be your host for this discussion today. I'm here with Dr. Shubin Stein, an orthopedic surgeon and co-director of the Women's Sports Medicine Center at HSS, who specializes in patellofemoral or kneecap disorders, meniscal tears, or the cushion between your thigh bone and your shin bone, and other common knee ligament injuries such as ACL tears. Also joining us is Dr. Michelle Q, an orthopedic surgeon specializing in sports medicine, knee, and shoulder at HSS. So let's get to it. Our first section will be discussing understanding how ACL injuries occur. So my first question is, what is the ACL and how does it tear?
So the ACL is a ligament inside of the knee. It's called a cruciate, so it crosses with the PCL deep inside the knee. The collaterals are on the outside, so if you hear about the words MCL or LCL, those are on the outside of the knee, but the ACL is inside in the center, and it prevents the knee from going forward and from rotation. So it provides rotational stability and stability in the forward to backward plane, particularly in the forward plane is what the ACL's main role is, in addition to providing rotational stability to the knee.
Great. So the ACL stands for anterior cruciate ligament. So how does it tear?
So it can tear in multiple different ways, but the most common one that we see on media or in the video or during sports injuries is more of a planting non-contact injury. So somebody goes to juke someone out on the basketball court or to kind of go around somebody in the soccer field, and you plant and you twist, and the knee has what we call a valgus moment where the knee bends in and it rotates, and that's how the ACL tears. It's the most common mechanism. That can also happen during skiing injuries and a more kind of traumatic, more of a traumatic injury where the knee twists violently, and other injuries such as car accidents and other more high energy injuries. But the most common that we know of is this non-contact pivoting injury, we call it, when someone plants and twists their knee and gets the ACL tear.
And I think it's important to mention, because we'll get into this as we discuss rehabilitation and return to sport, is it occurs during deceleration. So landing from a jump and like you said, cutting. But that is an important thing to think of, that deceleration.
It's also a really common ski injury. So you'll hear about people who are skiing. So the other way is, as Dr. Q mentioned, the non-contact pivoting or twisting injury on the field. But we see a lot of them during ski season in patients who aren't cutting and pivoting athletes. But when they fall during skiing, if the ski doesn't dislodge, if the boot doesn't pop out from the ski, there's a large force of vector, which is the ski kind of rotating the knee. And oftentimes that will cause the ACL tear. So many people will hear about people, and again, all shapes and forms, not a particular soccer athlete. It may be somebody who likes to go to the gym and doesn't do a lot of cutting and pivoting,
Right.
but they can tear their ACL skiing. And so we see a lot of that during the winter.
Right. And I also, it's important to say another mechanism is landing from a jump.
Yes.
Which is also another deceleration type of injury. So why are women at higher risk for ACL injuries?
There's a host of different issues that have been described in the literature for the last 20, 30, 40 years that we've really become interested in injury risk and primarily injury prevention. And we don't really know exactly the reasons why women are higher at risk, but there's multiple factors that have been identified across a multitude of disciplines. So starting with anatomy, women have different pelvis sizes has been identified as a risk factor. Our knees are inherently smaller. So the notch, which is the center of the knee, the hoop on the inside where the ACL lives is more narrow in women. That's been shown to also be a risk factor for ACL tears. Moving on to the muscles, we have different muscle balances. Our hamstrings and quads aren't balanced the same way that men are. You mentioned deceleration is a risk factor for injury. And so if our muscles are firing differently, and our muscles don't control the knee easier, the knee will go forward and tear the ACL when we're decelerating, versus men, they have a different muscle balance that is actually protective and keeps the knee more balanced when they're decelerating.
And one of the most critical issues is how you, as you spoke about before, how you land from a jump. So if you watch a female basketball player, or if you watch a male basketball player or soccer, when you watch them land from a jump or when they're cutting or pivoting, the men tend to be in much more knee flexed or bent positions. They're squatted, they're lower down, and that position of knee flexion is very protective for the ACL. So if you watch female basketball players, a lot of the time when they land from jumps, they will land in a more vertical upright position with the knee not as bent, and that's actually a much higher riskier position for the ACL. So that pertains to exactly what Dr. Q was talking about, which is this balance between the muscles and how we tend to move versus how men tend to move.
Yeah, and I think speaking to that is also the hips, right? Is maybe the females don't use their hips as much as the men, leading to that knee dominant or quad dominant strategy.
So that pertains and kind of rolls right into our next segment, which is how do we protect women and girls from having these injuries? And that really does, since we can't change the size of their notch and we can't change the size of the knee or the ligament, we talk about modifiable risk factors, and the neuromuscular or the muscle balance and the brain muscle connection is the number one modifiable risk factor that we can really affect.
And the studies have really shown that these preventative strategies, when they're applied to sports teams across even male and female athletes across all different ages, youth, high school, elite athletes, they do show a decrease in ACL risk and ACL tear risk. And so that is, the preventative strategies are critical to understand at all ages and all genders. It is hard to implement when you're practicing so many hours a day, so many hours a week, but it is critical to injury prevention to at least understand the risk factors and what coaches, players, trainers can help modify in their athletes.
Yeah, and part of the challenge with that has been compliance. Compliance with doing these programs and getting the athletes to participate in these programs. And they've been shown the more you do it, it definitely decreases the risk of injury. And it may be because not only are they addressing the risk factors, but there's also some level of fitness there.
100%. And the other part of this that we struggle with is these are athletes that begin at a very young age, and every year they progress. They can progress to a different level in school, a different level on the field in terms of their team. And so what happens is it has to be repeated every single year. It's not something you can train them for when they're 11 and expect them to be doing when they're 14. It has to be something that's implemented and part of their general workout. And if you watch the professional teams, most of the professional teams, certainly soccer does this, it's part of their warm-up. So they're mandated to do it all the time. And that's really what is hard for these growing kids or these kids who are getting older and going through the school system. Some years they may have an athletic trainer who's very vehement or really diligent about doing these types of preventative exercises. And sometimes the school doesn't have the resources and they don't have anyone to teach them.
Yeah, and you're so right, because these kids, as they grow, it's like they learn how to move in a different body. It's different height, different weight. Sometimes when we see a person from when they first got injured to when they're at the end of their rehab, their body has changed so much, so they're learning to move in a different body. And I think it's important to get the coaches on board. And part of the knock is that it takes time away from practice because they have limited time with these athletes to do skill stuff, etc. But losing an athlete to an injury is devastating. So that 15, 20 minutes is certainly going to be worth it for these coaches to invest in. Anything else you'd like to say about that?
Well, I think one risk factor that's been in the literature but has recently been in the national news, FIFA recently approved a study looking at the effect of estrogen on the menstrual cycle and ACL risk in the elite soccer players. And that's been known that women have inherent ligamentous laxity, meaning we're loose jointed. And as hormones change throughout the month, things get looser, tighter. And so studies have shown a correlation between estrogen levels and different hormonal levels throughout the month that can affect ligamentous injury. And so the FIFA recently approved a study looking at the effect of that. I think that is a huge step forward in really understanding a risk factor that previously was associated with possible injuries, but really understanding our female athletes and how we can help them understand their training regimens, maybe alter them during different levels, times of the month, to optimize their training and really keep them on the field.
Right.